Good day, global citizens. Welcome to another episode of Dr. Fajimola's Opinion. This is a platform where research meets understanding. Today we are discussing mental health. Mental health is a well discussed topic in Nigeria, coming with myths and facts from different angles. So I have my guest researcher for today is someone who has a publication on mental health, and I'm glad this is the first time. I remember this is the first. I don't think we've discussed mental health before. So I'm glad to put this as a foundation for the discussion of mental health, especially in Nigeria. Please join me to welcome Mr. Emmanuel Onyekwere. Mr. Emmanuel Onyekwere, how are you doing?
I'm very well, thank you. It's nice to be here. How we think, it affects how we feel, and also how we behave. I was glad when you mentioned about focusing on your mental health, and you mentioned something about you linked. There was a connection you made between mental health and productivity. Okay, so that's to say that whatever it is that affects our mind will definitely affect our body, and it brings to mind this there's this concept psychosomatism, psycho relating to the mind, somatism related to the body, which simply means whatever affects the mind definitely affect the body. And you have an interview you're attending for, and already in your mind you're feeling defeated. Probably the interview you're going for is something you on a normal day should nail. Okay, maybe it's a concept or it's a field in your area that you'll be interviewed on. But because you've already started feeling defeated in your mind, maybe who am I going to meet? What kind of questions are they going to ask me? Are they mean? And they all that. Already your mind is overwhelmed.
What are three things? What are three things we should know about mental health in Nigeria?
In Nigeria, okay. First, that is a growing concern. Okay, if you date back, let's say 10, 15, 20 years ago, it wasn't really much of an issue as compared to what we have now. All right, so there's a growing concern in mental health. Okay, because these days we've started hearing things like schizophrenia, post-traumatic stress disorder. They've been there, okay, but the prevalence is increasing currently. All right. So the second thing too is stigma. Okay, yes, I said one of the myths, okay, about it is that people think it is caused by spiritual or natural forces. All right, whereby someone complains about a particular thing or says something or speaks out about a particular mental health issue. Some people relate it to spiritual forces. So as much as we believe, most of and even the ones already in the healthcare industry, they should also be trained on mental health. Okay, so that we're able to also offer support to their patients. They also be able to also, even to the family members. Like you see, family members will bring in their family member that is maybe had an accident or anything, or is going through one problem or the other, and they are screaming, shouting, asking for help and all that. And yes, they are not doing it because they actually want to react that way. It's just because of the situation on ground. So it's also a way of the medical health workers or the health workers, providing emotional support to them. So, and also there's limited funding, of course, because there are limited access to all this. That means mental health is not well funded. If it is well funded, then definitely people will have easier access. And also coming to the